if you're not an AI user, I mean, it's coming. I do a lot of my work using AI to augment what I do. It's really been very fascinating especially for things like generating graphs and taking a bunch of data points that you give it and ask it to make a visual that sort of makes sense clinically. You got to tell it who the audience is. Like my audience are practicing CRNAs. I'm a CRNA and I'm doing a continuing education lecture. The audience is not my nurse anesthesia residents or undergrad nursing students because it would generate sort of a different feel, right?
No, I think it was a nice image. And I do use it for some of my ads, but I have to be careful because it's only as smart as you instructed, and it
That's
still
right.
can make mistakes,
Yeah.
which is why we need humans in the world, right?
Yeah, for sure. Yeah, it's interesting. Prompt engineering, I've heard this term recently. Like, how do I make AI do what I want AI to do for me? And it all is in how you give it the
Like
instructions.
free.
Because at least the way I use it in a very elementary way, it's very literal. So if you don't tell it exactly what to do,
Yes.
it's either going to do what you said, Becky, and just randomly make up crap, or it's not going to do anything related to
Yeah.
what you
But
want.
but I like it, like you said, not a graphic designer. And I often go on Canva and make my own stuff. I'm limited in my like ability to do these things. I have
100%.
tagged in a couple other people to do it too, but they aren't anesthetists. So they'll come back with something that looks great, but all the information is wrong. So long story short, AI does have, and people get real upset about AI, but they forget like our anesthesia machines have AI. That's how
Yes.
it interprets the pressures and adjusts your tidal volume. Like
Yep.
we're already using AI. That's what
Yeah,
all that is. It's programmed by the manufacturer. So AI is here. It's
it
just
is
how
here.
you use it. And what do
You
you
know,
do with your students, your residents? I've been reading some interesting things about how to, because you have to be real careful now that they aren't generating their stuff through AI
yeah,
and with AI detection. And also, I have a friend that uses it and says, put this into your AI and then write a paper about hey, how AI was wrong. Like
yeah,
catch the mistakes because you're an informed provider.
right. So, yeah, that's a good question. I think, like a lot of universities, everyone's grappling with using AI in the higher education space. And what I'll say that our kind of wholesale department level approach to AI in nurse anesthesia is we would rather teach you how to use it well so that you can use it in your practice and in your professional world than have it be a punitive thing that you're using it for XYZ. So we
Mhm.
have it assignment by assignment, and there are certainly some assignments, some things that need to be purely original thought, and absolutely AI is not allowed. There are other activities or assignments where it is required to be used, and we have different, platforms that we're asked them to use and specific ways that they use AI. And we hope my goal, I mean, I use it a lot in my classes. Every assignment I have, aside from just normal sort of tests where you sit down and take a
Mhm.
test, requires use of AI in some way, shape, or form. My hope is, at least at TCU, when our folks graduate after 3 years, that they've been exposed to the good, bad, and ugly of AI, and at least have a working knowledge of what it can do and how it can augment their practice, and where those pitfalls and red flags are. I'm doing a talk in a couple weeks in Australia at the World Congress on AI ventilation modes. I've been working with GE as a not as a consultant. I wish I were getting paid, but I'm not. But in designing sort of the clinical interface for AI adjusted
Wow.
and predicted ventilation modes. So like we talked about with the pressure volume loop, you look and you see and you make these decisions. Well, can AI overlay actually see that for you and actually make those adjustments? And I know we have a little bit of some machine learning, but we're talking like fully, I just push the ventilate button and that's it. And the machine from
Oh,
there
it does
does
a
ev-
few cycles and figures
every,
out and
yes,
adapts. Oh,
yes, in real time. They say per inhalation exhalation, one respiratory cycle, there's like 124,000 individual data points that AI
wow.
can see and adjust to per breath. So, you think of a 10 breaths a minute, and we're talking millions of data points. And you and I can't, I mean, Hell, I don't know about y'all, but sometimes I'm surprised when the blood pressure comes up 5 minutes later, different.
Mhm.
I can't imagine processing that kind of information in
Yeah,
real time. So anyway, it's fascinating what's out kind of out there on the horizon.
yeah.
So
And
yeah, and
remember the old Drager machines that we would like, you had to, you would adjust the tidal volume. It would never go to the right tidal volume. You'd have to tap the front of the other ones because when you changed the tidal volume, it changed the IE
yeah,
ratio.
yeah, yeah,
You remember those? And it
yeah,
was like on or off. There was
yes,
no mode.
yeah.
Like we've really come a long way.
We have. Anyway, we try to use AI and roll it out throughout our curriculum. You
Yeah.
know, we actually are trying to figure out how to use it well in teaching clinical decision making and clinical support. I mean, I don't know about you, but I think we can all admit, 2 o'clock in the morning when I'm doing my 14th blood gas on the 50 units of blood liver transplant, which is a lot of what I do in my practice, I'm not at my smartest. And so having AI to help me, and I do this in the OR, I actually have a HIPAA compliant through our hospital system AI platform where I will give it my blood gas, for example, and say, interpret this. And
Mm,
it doesn't take me out of the loop, but the subtle things that may not be overt, or what's really cool is when it gives you like, hey, consider the following thing. Your patient has some metabolic alkalosis. Okay, fine. I can diagnose that. Here
mhm.
are 10 things that may be contributing to that. And at 2 in the morning, I might have gotten through number 4 or 5 on my own, but 5 through 10 may have been something that I needed a little nudge. And man, has it been, for me in my practice at least, has it been super helpful in asking me to think a little bit more carefully or completely. So,
Mhm. Someone just say, I'll probably be one of those CRNAs 20 years down the road saying, I remember back in the day when, and talking about the
yes,
ventilators, pretty cool what
there,
there is. But again, you have to know the limitations. You still have to use your brain,
yeah.
obviously. But if you want
Well,
to use it to augment your practice. Now, what AI platform is your work okay with? I'm just curious.
so we have through our health system, there is an intern. I don't know. I think it's Claude, but I'm not sure in the background. But it's built into our Epic, and so it's
Gotcha.
HIPAA. Honestly, I don't know which of
But it's
the.
through the Epic. They have a link to
Yeah.
something else.
The
Yeah.
AI assisted ventilation, I think it's GE. Don't hold me to this. It may be one of the other ventilators, but it's not using it right now in the OR, although it may be coming. But in the ICUs, if the
Mhm.
patient has an A line, they're doing microsampling, so almost near continuous
Wow.
blood gas analysis, feeding into an AI brain that is then making almost real-time adjustments to ventilation parameters based on
Based on the
real-time
AQ.
feedback. And I mean, we have baroreceptors and
Mhm,
chemoreceptors. You and I do this all day, every day. We don't think
mhm.
about it. And that this idea that sort of can we emulate normal physiology when we're controlling it through AI is fascinating. And way, way smarter people than me are trying to figure this out. But I think it's really, really cool. So
Thank you again, Drew.
yeah, absolutely. Good to see y'all. Have a good day, everyone.